Hello everyone, and welcome to our poster entitled Government Measures Against the COVID-19 Pandemic Must Be Determined According to the Socio-Economic Status of the Country. In this poster, my co-author Alessandra Maria Salvatella and I were interested in exploring the question of how socioeconomic factors predating the pandemic related to the incidence and severity of COVID-19 in countries around the world. To address this question, we compiled a data set of epidemiological variables, which included the number of cases and deaths attributed to COVID-19 for the first 5 months of the pandemic. So that was up until May 2nd, 2020. For each of the 199 countries and regions, we compiled a socioeconomic factors data set that included 44 socioeconomic variables belonging to categories such as healthcare infrastructure and statistics, economic health and mobility, environmental health, demographic structure, societal characteristics, and religious characteristics. And because the spread of COVID-19 can relate to the spatial distribution of the countries around the world, we incorporated a geographical weighting matrix, A, that we calculated in which we calculated the pairwise distances between the capital cities using the coordinates of those cities and the radius of the Earth and the spherical law of cosines. So for our analysis, we ran a bunch of different models, 32 in total, in which we considered one of 5 different outcome variables. So cases, deaths, cases as a percentage of the total population, deaths as a percentage of the total population, and deaths per cases. And we considered all of 44 of our socioeconomic variables, or all of those except for the total population count. We tested models both with and without our geographical weighting matrix, and we considered models that incorporated some kind of automatic variable selection, such as lasso. From all 32 of these variables, we calculated a signed importance index, which is an index that measures the relative importance of our variables across all of these models. So if a model appeared very frequently in the top 10 most important variables in all of our models, that would increase its count according to its sign. So if it was a positive correlation, it would be positive, and if it was a negative correlation, it would be negative. So jumping right into our results, based on the multiple R squared, our best models were always those that were just using number of cases or number of deaths, and they did not incorporate the geographical weighting matrix. When it actually came down to the socioeconomic variables of interest, beginning with healthcare infrastructure and statistics, we saw that countries that had more nurses and midwives and hospital beds had a higher incidence of diabetes prevalence and lower life expectancy and lower death rates, tended to have fewer COVID-19 cases and deaths. Increased numbers of physicians and access to essential healthcare services did not seem to be associated with decreased cases or deaths due to COVID-19. For economic health and mobility, we saw that countries with higher employment rates and less economic disparity tended to have fewer COVID-19 cases and deaths, and countries with greater government health expenditures do not see a decrease in government COVID-19 cases and deaths. Interestingly, as you would expect, increased population mobility did correlate positively with COVID-19 cases and deaths. As far as demographic structure goes, countries with older populations, greater population density, and greater proportions of their population from migrant stock tended to have greater proportions of their population affected by COVID-19, though the proportion of cases leading to deaths was unaffected. Societal characteristics impacted in a very interesting way. Countries with populations that had greater access to internet tended to have lower rates of COVID-19 cases and deaths relative to the total population, and fewer cases that led to death. Countries with more effective governments and populations that had greater personal and economic freedoms also tended to have fewer COVID-19 cases and deaths, cases that led to deaths. Overall, our take-home messages were that understanding how a country will be affected by COVID-19 requires more effort than simply looking at its neighbors. Governments may benefit from heterogeneous allocation of healthcare resources and a decentralization of the healthcare system. Blanket policies appear to be suboptimal, as greater government health expenditure and access to essential health services is not necessarily a guarantee to success in combating the pandemic. And finally, countries that seem to have more informed populations, that had greater economic equity, employment rates, and personal and economic freedom were guided by effective governments, appeared to have done better in the first months of the pandemic. Thanks very much for stopping by, and we hope to chat with you soon.